It was approximately 6 years ago that I got involved in understanding about cannabis. My mom had been diagnosed with idiopathic pulmonary fibrosis, and I was working at that time in the state of Washington as a family doctor and doing occupational medicine. And I was also an MRO, which is a medical review officer, where we do drug testing as well. And my mom was watching a TV program, and it was about how cannabis had been used in Israel for COPD, asthma, and lung cancer. And I could still hear her saying, look at this, they're using ganja. At that time I realized that how could they be using cannabis? And that why would you smoke something, especially if you can't breathe? And that was sort of my aha moment. And it was then that I started to learn that there was a system known as the endocannabinoid system. So what I had realized is that I had never learned about the endocannabinoid system. Even with all the years of education that I had never even known that there was a system. We'd heard about the respiratory system, the endocrine system, a nervous system, but never about the endocannabinoid system. And it was then that I realized that the endocannabinoid system is actually a system that's been around for over 600 million years. It's evolved from the sea squirt to what we have in humans today. And what we understand is that this system, I describe it in one word: life, balance, homeostasis. And that's what the endocannabinoid system means to me. I use the words of Dr. Damasio to explain it. Dr. Damasio explains the endocannabinoid system by saying that it helps us to relax, eat, sleep, forget, and protect. And when I look at these 5 words, I think about it again as balance. So too much or too little of these 5 words. So if somebody relaxed, as we say, if the muscle was in a constant spasm, or if it was flaccid, didn't move, it would be an imbalance of a muscle system. And we see that with illnesses. The same way, eating too much or not eating enough, sleeping too much or not enough, insomnia, depression. When we think about forgetting, I always use if people forgot too much, we think about Alzheimer's or dementia. Mm-hmm. What if they didn't forget enough, right? We think about PTS, post-traumatic stress. And this is one of the things that we hear about a lot about right now with veterans. Yet, people that are not veterans also experience post-traumatic stress. We have people that have been through so many different types of traumas. So when we think of people remembering something over and over that creates anxiety or depression or those flashbacks, and let's look at protection. Too much protection or underprotection, autoimmune illnesses like MS, rheumatoid arthritis. All of this is an overprotection of the body. If you're underprotecting, so if you have diabetes, if you can't fight off an infection, or you've had chemotherapy and you're not able to fight off infections, again, you're immunocompromised. So again, to recap, relax, eat, sleep, forget, and protect. So an imbalance of these can cause a balance and difference. Or what we're learning is a deficiency. If there's a deficiency in this system, we're learning things like migraines, IBS, fibromyalgia are all related to when the system doesn't work. If there's an overactivity, we're learning about maybe even obesity, even addiction, some of these things where the capacity could be overactive. And again, giving us the cannabis to give this to a balance. And what we've also learned is that when we talk about a system, the endocannabinoid system, we talk about endo, meaning within our body, and cannabinoids. So let's talk about that. So cannabinoids, we can talk about phytocannabinoids, which are plant-driven. We talk about synthetic, which are made in a laboratory, and phytocannabinoids, which are plant. So we have synthetic, laboratory, plant-driven, phytocannabinoids, and endo, made within our body. Now, all 3 of these work with receptors. So the first receptor was first identified by Dr. Meshulam. So let's tell you about Dr. Meshulam. In Israel, in 1964, he was the first one to identify in the plant cannabis, cannabis. Canna means stalk or fiber, and bis means a plant with two sexes. And ma is also the same word in Chinese. So what they identified was THC, the psychoactive component, CBD, the non-psychoactive component, and CBN to about 1/10 of the psychoactive property. Now we know that cannabis has over 400 different chemicals, over 80 different cannabinoids, and THC and CBD are just two of the cannabinoids that we hear about, but there's many, many more. And what we're also realizing is that with these cannabinoids, each of them can play a role. They're anti-inflammatory, they're bronchodilation, they also have impact with cancer. And what we've learned is that, in particular, cannabis works so beautifully with cancer. Because when we treatment for cancer is either chemotherapy, radiation, antibiotics. Now, cannabis is very selective. Cannabis is able to pick the receptors based on the cancer cells, and it's able to target the cancer cells and not the healthy cells. Versus with chemotherapy and radiation, it's a complete wipe down. They go in and they kill everything. Cannabis is able to target the cancer cells, and it works in 4 particular properties. It works by what we call anti-proliferation. It doesn't let the cancer cells multiply. Anti-metastasis. It doesn't let the cancer cells spread. It causes blood supply to be cut off. Anti-agenesis. It causes the cells to cause what we call a cell death. To have them commit suicide, we call that apoptosis. So it's anti-proliferative, anti-metastatic, anti-agenesis, and causes apoptosis. And that's how it works for cancer. So let me go back to these receptors. What we found out is the first receptor was identified as CB1, cannabinoid receptor 1. They identified this in 1988. It was primarily in the brain. CB2 was identified a few years later and was primarily in the immune system. But what we find is these receptors are everywhere throughout our body. That's why it works for so many different ailments. We're realizing that it works because maybe what I believe is that there's a deficiency or an overactivity, and this is what causes illnesses. And once we can understand why everybody is different and why, and this is very important to understand that different amounts of cannabis is needed and different ways of how we give the medicine. And that's a perfect way to let's talk about delivery systems. Okay? Delivery systems. We talk about inhaling it, ingesting it, putting it on topically, or other methods. So let's talk about inhalation. Inhalation is rapid. So we can either smoke it or vaporize it. Now, a lot of people have a lot of misconceptions. Let's talk about those misconceptions. And do you remember in the beginning I said to you that why would you smoke something when you can't breathe? So what do we do when somebody can't breathe? We give them an inhaler, or we give them nebulizer treatment, we give them oxygen, but we're giving them something so that they can open up their bronchioles, or that to bring down the inflammation. It's either forms of steroids or bronchodilators, and they either make your heart race, but they're trying to get you to open up so you can breathe. Well, inhalation again, you're breathing this in. So smoking, any kind of smoke is an irritation. Let's face that. So if we were to have a smoke that to blow against our face, like from a fire, it would cause an irritation. Vaporization is a cleaner method, but again, inhalation is what we're talking about as a delivery system. It's very quick onset. Within seconds to minutes, you feel the impact of it, and it lasts for a short period of time. And everybody's different. Ingestion, a little tricky. Remember, when you ingest it, it has to go through a process. It's not a direct effect. It has to be broken down, and everybody can be different. Somebody that chews it faster, somebody that's got maybe other medications on board, or if their liver metabolizes, it's different. But the metabolite that it creates is much stronger and it lasts longer. And so therefore, it can take its impact much longer than it has the effects, and it can last longer. But again, it's a method known as ingestion. Topicals, a wonderful way where you don't get any of the psychoactive effects, but you get all the medicinal properties. You can apply it on topically, where it's great for skin issues. So for psoriasis, eczema, skin cancer. But it's also a delivery system. So for aches and pains, it's able to get through and people are able to work. What we also realize is that with a delivery system, so people combine it with different things. They're able to even apply it abdominally for people with belly pain. So people with, they're using it at things like Tiger Balm, things like DMS. So again, delivery systems of how they're getting it into them. And other methods, let's talk a little bit about that. Suppositories. If you've got somebody like a baby that's having a seizure or somebody that's got nausea, you don't want to put something down in your mouth. And so the mouth and the anus are wonderful ways of delivery system. So the rectum, you can put a medicine, suppositories that are wonderful, very quickly to react, much quicker than even the mouth. And then vaginal suppositories, so women with vaginal dryness or other issues, pain, cancer treatments, again, a delivery system. So let's recap. Inhalation, ingestion, topicals, and other ways, suppositories in different ways. So two primary strains that we talk about, sativas and indicas. And I used to always get these confused. So I try to make it as simple as possible. So I always say sativa starts with the letter S and indica starts with the letter I. So sativa, S, I think of sunshine. Indica, I think of insomnia. So when do you get insomnia? Usually at nighttime. When does the sun shine? Usually in the daytime. Now, this is just to give you some guidelines. None of this is written in stone. And again, remember, everybody's a little different. And hybrids are a combination of these two. So they could be more sativa-based or more indica-based. And that's what a hybrid is. So, 3 basic rules you gotta always remember. Always, always, always. Hydrate before you medicate. Start out with consumption of cannabis low or very low and slow with food. And journal. And journaling is very important to me because everybody's different and you don't know what you're getting. What you got the last time, Blue Dream, Bubba Kush, whatever Kush it is, whatever the name it is, doesn't mean anything to me because everybody's different. So again, let's repeat those things. Hydrate before you medicate. Start out low or very low and slow and with food, and journal. Because I want to know how it's working for you. And that's what's important. Okay? So, rule number 1, safety first. Do no harm. That's what I truly believe in. And when we talk about safety, that's not just for the person that uses it. It's for your family members. It's for your pets. It's for everybody. If you're bringing it wherever you go, it is still a medicine and it should be treated as one. Okay? So safety first and do no harm. I want to see 3 things. I want to see everybody to understand that there's a system known as the endocannabinoid system. I want healthcare providers to know about this. I want to see a specialty of doctors like myself that are specialized as cannabis therapeutic specialists. Number 2, I want to see that we can have laboratories where we can get our medicine tested. And the second part of that is we need ISO standardized laboratories so that they're certified so that we can make sure that everything is done properly and that the testing is done repeatedly and we're getting the same results. And the third thing I want to see is a label. Just like you pick up any other thing, there should be a label. And what I'd like to see, the label is in the form of a dial so that we could see that we're speaking about the same language. So again, consistency. safety, do no harm. So what I'd like to see as a future is that this plant that was food, fuel, fiber, paper, and medicine, that's what it was in this country. And a little bit of history and what I want to see happen. Everybody needs to know that nobody has ever died from cannabis, that this was prescribed by doctors, it was in the pharmacopoeia, and it was there in the United States of America, and it was listed in the pharmacopoeia from 1850 to 1942. The U.S. government has the patent for cannabinoids as an antioxidant and as a neuroprotectant, and they've had this since October 7th of 2003, patent number 6630507. Please look it up. The main thing that we also want people to understand is that we are facing an opioid epidemic. We have people dying. United States is 5% of the world's population, consuming 80% of the pain. We are losing a vet, practically 1 per hour, over 22 per day. These are the facts that we need to understand. We need to understand that these 5 things, food, fuel, fiber, paper, and medicine, it should be what cannabis should go back to. It was because of people like the Hearst family, the DuPonts, Rockefeller, Carnegie, and Mellon, and the badass mouthpiece, Harry Anslinger, that tainted this medicine, that brought about racism and changed it. It was not because of evidence-based medicine. It was because of politics and racism that this medicine was placed in prohibition, and that happened in 1937. They changed the name. What cannabis was in this country in the 1600s, you faced prison sentence if you didn't grow this plant. Today, we face prison sentence for growing this plant. What it should be is that food, fuel, fiber, paper, and medicine, it needs to be brought back into the world. It should be available as medicine and as industrial properties, and it should be something that we can make the world a better place to live. What I truly believe is that cannabis is not for everybody yet. It should be a first-line option and not the last resort. What I want to see is cannabis to be descheduled. Right now, cannabis is in Schedule 1, along with heroin, LSD, and ecstasy. And it's been there since 1970. So in 1970, the Controlled Substance Act was brought about. And what we did is we placed drugs into different schedules. And there's 5 schedules. And it's based upon whether that there's medical use in the United States, whether that there's medical research in the United States, and a potential for abuse. Okay, so in the United States right now, we have an opioid epidemic. What I want to see is that cannabis is available to everybody as a first-line option, not the last resort. I've been saying this for years. Cannabis is not an entrance drug. It's an exit drug from pharmaceutical and narcotics. And I truly believe this. I am seeing in my practice, we have patients that are actually losing weight. They're getting off their blood pressure medications. They're able to lessen their diabetes medications. We're seeing decrease in their opioids and even removal of their opioids. People's lives are being improved, quality of lives with their families. Some of them are getting back to work. They have a better relationships. Sexual lives are improving, not only with their significant others, even with their families. You know, I've heard statements like, happy wife, happy life. I see relationships improving between the husband and wife. I see generations being brought in. I have grandmother being brought in by the grandchild, the daughter bringing in her mother or even her child. And so we're seeing this as an option. And I truly believe cannabis is an exit drug. And I'm planning to write a book, Cannabis, the Exit Drug. Please look forward to it soon to come. Thank you.